All right, let's talk about hooking the console up to the Hamilton ventilator. We're going to start here on the inspiratory port, and we've added what's called a dosing T directly on the inspiratory port. This red line will run all the way back to the console, and it's what puts the nitric into the system. Make sure that we have this IsoGuard filter after the dosing T, so that this room air that's coming with the nitric gets filtered before it gets to the patient. On the expiratory side, we have a standard expiratory valve and a HEPA filter, just like we would on any infectious disease patient. And then we have our flow sensor lines that we would have on a normal vent circuit as well. On the other end of this circuit, we have a T, and on the inspiratory limb, about 6 inches back, we have this sensing T. Now the inspiratory side is always blue, starts blue here and ends blue here, and the expiratory side is clear, just to eliminate confusion. And what this is doing is this is sensing the nitric being delivered and telling us, are we actually delivering what we want to deliver? So say we try to put in 20 parts per million here, but it's only measuring 18 here because we changed our respiratory rate, it'll dose more up at the dosing T. Now, the last thing we have to connect up is the console. And so these red and blue lines connect up to the console. So the blue line goes to the water trap, that's the sensing side, and the red line goes to the nitric side. This is the dosing side. Now we have a complete second setup of these because you would normally have a second console in the hospital. We don't have a second console running all the time. So we use this little double-sided cap. It caps off both sides with the same cap. We just want to make sure that's nice and snug, otherwise it won't pass a leak test. Once that's connected up, we'll go ahead and start our cassette preheating. Now when we look at our cassettes, we want to make sure that the foil disc is not punctured. You can see here's a punctured foil disc and here's an unpunctured one. And you also want to make sure that this blue dot is completely blue and not browned out. This is an activated cassette, so this one won't work. So we're not expired. We have a blue dot and the foil is not punctured. Now don't pull on this lever while you're inserting the cassette. Insert the cassette smoothly, and when you push on it, the lever drops halfway down. That's going to tell the machine that it's ready to start the leak test and the preheating process. You'll see it, the cassette begins warming up, and on the screen we get the message that it's going to begin a leak test. The only thing you have to do for a leak test is come down to the stopcock here on the sampling T and turn it off. You have about 60 seconds on screen to do this leak test. Once you've turned it off, the leak test completes in about 3 or 4 seconds. Open the stopcock back up, and you should never have to use that stopcock again. You can also perform a leak test while you're dosing the patient. Now you'll see on the screen that the cassette is warming up. We're at 57%. We'd want that to be at 100% before we start dosing, otherwise we won't be able to create enough nitric. And it now says we are preheated. So we're ready to go into the room and get the patient onto nitric at this point.